While looking for an article to research for the current event, I was on the California Healthline where I found an article regarding a 7-year project that the NIH was doing. This article was very brief, so I went to their sources on this article and I found an article from the Sacramento Bee that went into more depth. Reading this article, I learned lots about the 7-year project. The National Institute of Health is launching a new project to help unravel how early environmental exposures may affect different aspects of children's health, such as autism, obesity, and respiratory diseases. Dr. Francis Collins, the NIH director, said the goal of this project is to really understand that interplay between the environment and genetics and behavior that play out to determine whether a child ends up healthy or not. This project is being titled Environmental Influences on Child Health Outcomes, or known as ECHO. This is a 7-year project and it will examine such interactions in pregnancy and early childhood, focusing on 4 areas of special public health concern: asthma and other airway disorders, obesity, neurodevelopment disorders including autism and learning disabilities, and birth defects and other infant health outcomes. This project was just announced on Monday. It is the next step after the previous failure of an earlier attempt to study how the environment and genetics interact with a child's health. The ECHO project, rather than starting from scratch to recruit participants, researchers with child health studies already underway can apply to expand them, using new technologies to measure even small environmental exposures that would be analyzed at an NIH-designated lab. For example, an asthma study might use wearable monitors to uncover what triggers a child's asthma attacks, or compare air pollution sensors with inhaler use. NIH said it plans to spend about $160 million in ECHO research this year. Because we are future health administrators, we want to know how projects like this will affect us in our careers, so I did more research on the CDC website regarding asthma and other respiratory diseases. We don't know for sure what causes asthma, but we do know that the attacks are sometimes triggered by allergies, exercise, occupational hazards, tobacco smoke, air pollution, and airway infections. There's no cure for asthma. People with asthma can manage their disease with the medical care and prevent attacks by avoiding triggers, but there will be no cure. Is asthma really a problem? Yes, asthma is a serious health and economic concern in the United States. Like I mentioned before, asthma has no cure, so it's an ongoing disease that is constantly needing treatment, which is expensive. Asthma costs the United States about $56 billion each year. The average yearly cost of care for a child with asthma in 2009 was $1,039. In 2008, asthma caused 10.5 million missed days of school, 14.2 million missed days of work. In 2010, 18.7 million adults had asthma, that is equal to 1 in 12 adults. 7 million children had asthma, that is equal to 1 in 11 children. It is deadly. About 9 people die from asthma each day. And in 2009, 3,388 people died from asthma. It's getting worse. In the last decade, the proportion of people with asthma in the United States grew by nearly 15%. In 2009, asthma caused 479,300 hospitalizations, 1.9 million emergency department visits, 8.9 million doctor's visits. Another common respiratory disease is chronic obstructive pulmonary disease, COPD. It is the 4th leading cause of death in the United States. In 2006, approximately 120,000 individuals died from COPD, a number very similar to the reported number of deaths from lung cancer that year. It is nearly 8 out of 10 cases COPD is caused by exposure to cigarette smoke. In addition, other environmental exposures, such as those in the workplace, may cause COPD. In response to the worsening problem of asthma and other respiratory diseases, the CDC has launched the National Asthma Control Program, a public health response to control asthma in the United States. Since its establishment in 1999, the NACP has been working to ensure that people with asthma get the care and education they need to manage the disease effectively. The program currently funds asthma control programs in 34 states, Washington, D.C., and Puerto Rico, serving 85% of the U.S. population with asthma. Why are the demographics of asthma important to us as future health administrators? Well, we know that education on asthma will save us money. In order to be most effective, we want to aim our education and promotion towards those that are more likely to have asthma, rather than wasting our funds on those demographics that aren't likely to have asthma. What makes a person more likely to have asthma? Women are more likely to have asthma than men. In children, boys are more likely to have asthma than girls. Adult ages 18 to 24 are more likely to have asthma than older adults. Multi-race and Black adults are more likely to have asthma than white adults. Black children are 2 times more likely to have asthma than white children. Adults who don't finish high school are more likely to have asthma than adults who graduated high school or college. Adults with an annual household income of $75,000 or less are more likely to have asthma than adults with higher incomes.